And then vaccination, need I say more? We are over vaccinating our pets. And what's happening is those pets already have the antibodies to that vaccine that was given, or hopefully they do. And then we're revaccinating, and then we're revaccinating, and we're doing like 5 or 6 different vaccines all at one time. I'm not here to say that vaccines are bad, because they're not. They're necessary to help prevent disease, but we need to be vaccinating appropriately and smartly, and we need to be asking for titers. Okay, this is a great question. Please review the titers again. What is it? Do I simply ask my vet about this? Okay, this is a really important question. So titers. So this is in reference to vaccines. So when you go in every year, usually you should be going in every year for at least a wellness check. Your vet should be getting their hands on your pet, examining them, making sure they're not feeling any lumps and bumps, listening to their heart, feeling their abdomen, checking out their coat quality, and also asking you questions like how they're doing. That is really important. I see a lot of people shying away from going to vet clinics because they don't want to be told that the food they're feeding is bad or things like that. But we still should be taking our pets in to be assessed, because as a vet, there's a lot of change that can happen over an entire year. Believe me, I know that with my own pets in the past, a lot of things have changed. So titers, what they are, so typically you go in, your pet gets vaccines every year, and then it's like sometimes they get like 5 or 6 vaccines, and then you leave, right? So that's usually like a wellness exam. Sometimes you'll get blood work done, which I also recommend at a wellness annual exam every year from year 1. I recommend blood work because I can track trends. I see trends happening. We can fix disease before it even shows up. But that's an aside. Back to titers. Titers show whether your pet has antibodies against the disease we're vaccinating for. So let's use parvo, for example. So the parvo disease your pet can pick up, this virus stays in the ground for like 7 years or more. Your pet can come into contact with it at any time, and it can make them really sick. If we want to talk about causing like severe leaky gut, parvo will destroy your pet's gut health. And so we don't want them to get that. So with the titers, so say your pet gets its puppy vaccines, and then you go in at a year, have them run a titer. And what that's going to do, it's a blood draw. They send it off to a lab. So most of the time they can't run that in the clinic. They have to send it off to special labs to check it. What comes back is a number. So usually there's a range. And if your pet is registering with a positive titer, meaning that some antibodies showed up, that means that their immune system is prepped and ready to fight that parvovirus if they came into contact with it in the environment. Some vets do it. I've worked in a clinic where we did titers every time, every wellness exam. We recommended titers. Not every pet parent did them. I'm not sure why, but a lot of vet clinics don't do them. So I would definitely ask. If they say no, then I would find another vet. Now the thing with titers is that you can titer rabies, but rabies is required by law by most states. And so legally we have to give rabies. You can still do a titer for it. Your titers are going to be higher in price usually because of that. But that's something where parvo, distemper, leptospirosis, if you're in an area where there's lepto, that is an annual vaccine. That is a bacterium. It's not a virus. And so the immunity does not last as long for those types of diseases. But you should be assessing your pet's risk rather than just giving everything. Same with Bordetella. Does your pet come into contact with other dogs? No, then don't give it. Same with influenza. Does your pet come into contact with other dogs? No, don't give it. And so with cats also, you can do titers too. You can do your calicivirus, your panleukopenia. So you can titer these, so that's another vaccine that doesn't necessarily have to be given just to give it. So that's what a titer is. If that still didn't make sense, just comment below.